Hello everyone. So today we will be discussing the cardiac chambers and the physiology related to that. So we all know that there are four chambers of the heart, that is the right and left atria and right and left ventricle. So the pressure of the right atrium is 1 to 7 millimeter of mercury. The pressure of right ventricle is systolic 35 and diastolic 4 millimeter of mercury, whereas that of the left atrium is 10 to 15 millimeter of mercury, and left ventricle has to pump the whole blood into the body, so it has the highest pressure, that is systolic 140 and diastolic 10 millimeter of mercury. So what is the pulmonary artery pressure? That is 35 by 15. Now we come to the stroke volume. Stroke volume, we all know the formula, that is a basic formula, and systolic volume minus end diastolic volume, that is 120 ml minus 60 ml. So that gives you 60 ml the stroke volume, and ejection fraction is the division of the stroke volume over the end systolic volume. So 60 divided by 120, that will give 60.67 of ejection fraction. So now we come to the cardiac output. Cardiac output formula is stroke volume that we just calculated into the heart rate. In males it is 5.5 liter per minute, and in females it is 4.5 liter per minute. What is the cardiac index? It is the cardiac output over the body surface area, and it is 3.2 liter per minute per meter square. Now we come to the Starling's law. So what does the Starling's law say? It says that the force of contraction is proportional to the fiber length, and the fiber length is proportional to the stretch of the ventricular muscle, that is the ventricular dilatation, and ventricular dilatation is proportional to the venous return, that is the preload. Now preload depends upon five things, that is intrathoracic pressure, the blood volume, the gravity, the calf muscle action, and it depends upon the venous tone. Now you have the afterload. Afterload is, it actually depends upon the arterial resistance. Now you have the cardiac autonomic control. So it is via two things, the baroreceptors and the chemoreceptors. So baroreceptors are inhibitory, and there are three types, that is the carotid sinus, the aortic body, and the sort of fourth ventricle. So coming on to the carotid sinus, it is located at the bifurcation of the common carotids, and it is innervated by the glossopharyngeal nerve. Coming on to the aortic body, it is located at the aortic arch, and it is sensitive to oxygen, carbon dioxide, and pH. Whereas the floor of fourth ventricle, it is sensitive to the CSF pressure, and the Cushing reflex is actually increased CSF pressure will cause the rise in the BP. Now coming on to the chemoreceptors, it consists of the carotid body and the central chemoreceptor. So the carotid body is located at the bifurcation of the common carotid artery, and it is sensitive to the oxygen, carbon dioxide, and pH, and the central chemoreceptor is sensitive to the carbon dioxide. Now coming on to our next topic, that is the coronary circulation. Coronary circulation is 4 to 5% of the cardiac output. The coronary flow rate at rest is 80 ml per minute, and it is greatest during the diastole. And what is the myocardial oxygen consumption? It is 8 ml per 100 gram of the tissue, and we know that the heart weighs 250 mg overall. Now coming on to the blood vessels, it has three layers. We know it is the tunica interna, media, and the externa. So externa is the thickest layer in the veins, and the veins have valves. Tunica media is thickest in the arteries, and capillary, obviously they are single layer, they only have this interna. Now the blood pressure. Blood pressure is equal to systemic vascular resistance into the cardiac output. It depends upon six factors, that is the blood volume, obviously, the viscosity, elasticity of the blood vessels, the diameter of the blood vessels, and the length of the blood vessels, and On sixth, we have the hormones, that is the angiotensin converting enzyme, antidiuretic hormone, and the adrenaline. And whereas systemic vascular resistance is concerned, it depends upon three factors, that is neurogenic via the central sympathetic outflow path, metabolic, we have the mnemonic HOC for it, protons, oxygen, carbon dioxide, and potassium. And endocrine may we have the mnemonic APS-KC, that is adenosine, prostaglandin, serotonin, kinin, and the catecholamines. Now we come to the MAP, that is the mean arterial pressure, that is a diastolic pressure plus 1/3 of the difference of the systolic pressure minus systolic pressure. So blood flow, it actually follows the Poiseuille's law, that is, it is directly proportional to the pressure and radius and inversely proportional to the viscosity and length. Viscosity increases in a person if the hematocrit is more than 45%. Thank you.